Hello, my name is Brianne Bartel, and today I will be presenting with my colleagues Taylor Martin and Dr. Laura Sokol on the effects of animal-assisted activities on the well-being of post-secondary students. Throughout the presentation, we may refer to these animal-assisted activities as AAAs. We live in Winnipeg, Manitoba, Canada. Taylor is a University of Winnipeg graduate and first-year teacher. Laura Sokol is a professor of education at the University of Winnipeg, and I am a current University of Winnipeg student and teacher candidate. Our presentation will have 3 parts and will take about 20 minutes, and Taylor will get us started.
Thank you. So I'm going to start with discussing some of the prior research in this area. You can see here it says PSS, and this is referring to post-secondary students. We found that there's an alarming and increasing prevalence of mental health issues in young people in Canada. The statistics you see here on the screen are 2019 national statistics. And what we found was that there was increases in every single category since the 2016 survey. There's also increases in budget demands for student supports. 93% of offices have increased budgets by an average of 35% in the past 5 years. So we're finding that there's a big difficulty keeping up with the demands of the students. In order for students to qualify for these services and for accommodation, they have to provide medical documentation. This creates barriers for some students who do not have financial resources or family doctors. The research is also showing that not all of the students reporting these findings are seeking help. Students who experience unaddressed poor mental health are also more likely to drop out of school, which is not only a cost to themselves, but also to society. It's also interesting to note that these are, as their 2019 statistics, they're pre-COVID-19. So it is also reasonable to assume that these numbers are currently higher during the pandemic. The current medical model that serves as the foundation for student mental health services at post-secondary schools by itself is insufficient to meet the current needs that we're seeing. Students with mental disabilities are not the only ones who sometimes need help, and not all students who struggle have mental health diagnoses, and not all of these that do seek services for them. So with this in mind, CMHA has reframed mental health and well-being based on this model that you see here by Corey Keyes, which supplements medical models of mental health. On one side of the spectrum, we have serious mental illness, and on the other side, we have no mental illness symptoms. On the bottom, you see poor mental health, and on the top, we see optimal mental health. These 4 quadrants where these topics intersect, you can kind of see some of the variation here. And it's important to note that mental illness is not the same as mental health. So the key takeaway is that you don't have to be sick in order to get better, and that each of us can do daily activities to support our mental health the same way that we would do this for our physical health, such as eat healthy food, exercise, and sleep enough. There are things we can do day to day to support our mental health. A good example of this is COVID-19 and how, a lot of people who didn't have prior mental illnesses are struggling with their mental health just naturally as a result of isolation and other aspects of this pandemic. Earlier, Brianne mentioned to you that we're doing our presentation today on animal-assisted activities, or AAAs, but you might be wondering, what are AAAs? So I'm hopeful that most of you have encountered friendly, trained dogs and handlers in public settings, such as airports, schools, hospitals, or long-term care centers. And if you have, then you would have witnessed AAAs. So generally, these are short meet and greet sessions of animals visiting people in a variety of environments. The visits can be spontaneous, and they can also be as short or as long as necessary. AAs are common in North American schools much more than they are in Europe, after being initially introduced at a university in our capital city, in Ottawa. Since then, they've become very popular in post-secondary institutions in Canada. These AAs can take various formal and informal configurations, but the most common one is monthly or semi-monthly drop-in sessions with dog handler pairs from St. John's Ambulance. The St. John's Ambulance program issues certificates after the animals and their handlers have passed rigorous testing. The animal handler teams in this program are required to complete a minimum number of hours each month, in order to maintain certification. Two of the main takeaways that we got from these past studies is that there's lower levels of stress in post-secondary students as a result of AAs, and also lower anxiety and blood pressure. There's also some limitations to AAA research in post-secondary schools. So there are many studies of AAs with university students, hospitalized individuals, and elderly people in care homes, as well as school children. And usually these studies report positive results in which, we as consumers are very eager to believe because they make us feel really good, but we don't question the findings in more detail. So 2 reviews of the research in this field have revealed the list of limitations that we've shown here on the slides. We also need to consider 2 other kinds of drawbacks when considering animals in post-secondary schools. So you'll see 4 bullet points on the slide, but they do kind of fall under 2 main categories, and this is student well-being and animal well-being. So the student well-being is related to allergies and also fear of injury by animals. And then on the other side, we have animal welfare. AAAs are actually not allowed in many European schools as they view the use of animals only for petting and human pleasure as unethical. Animals can also be mistreated by students or neglected when they're not in service, which brings us to our study.
So now for our research. We set up a study with 2 purposes. First, we wanted to isolate the factors that were associated with positive effects of AAAs in post-secondary students. Second, we wanted to do it in such a way that the welfare of animals and welfare of students who were allergic to or afraid of dogs would be respected. At the University of Winnipeg, we have Doggo Days, which occurs monthly. On these afternoons, trained dogs from St. John's Ambulance come to the school with their handlers and hang out in our student center. So Taylor mentioned the vigorous certification that these dogs and handlers go through. This includes criminal record checks, references, dog evaluations, and canine vaccinations. At Doggo Days, students can come and go and play with the dogs as they please. A similar program runs at the local college, also working with dog handler pairs from St. John's Ambulance, and uses the same format as at the University of Winnipeg. Our study design uses the participants as their own control group, which allowed for a balance of participant demographics. Therefore, if there were 10 males living in rural Manitoba with a pet in the control group, those same 10 males were also in the experimental group. Our study also screened for whether people liked dogs or not, and considered both the effects of touch and how long students interacted physically with the animals, as this was missing from prior AAA research. So looking at the left side of the screen here, to start, participants filled in Survey 1, which included demographics data and the World Health Organization Well-Being Scale, supplemented by additional questions. Participants then visited with the animals for a 10-minute no-touching period in Phase 1, and then they filled in the survey again. Participants were then free to touch and visit the animals for the duration of their choice in Phase 2. After this, they filled in the 3rd and final survey. We gave them $5, thanked them for their time, and they went on their way. We were interested in changes in students' well-being, happiness, and stress. So our findings show that while the observation phase did result in higher self-perceived well-being and lower perceptions of stress, there were no significant differences in self-perceived happiness when the total group was considered. Simply being around the animals is not enough to have a better sense of happiness. However, upon touching the dogs, our findings showed a significant decrease in self-perceived stress and significant increases in self-perceived happiness and well-being. And all of these positive differences were at a significantly greater magnitude than in the observation phase. So overall, we saw greater changes during the touching phase, telling us that touch is one of the important variables that we need to pay attention to when we are designing animal-assisted activities.
But we want to go back to the Acha findings now that showed the high level of distress in post-secondary students. We were interested in parsing out the students who were really struggling from other students to see if AAAs could make a difference for the struggling students. We asked the students in Survey 1 if any recent event was affecting their mood, and if so, we asked them to classify the event as positive or negative and to describe it. Representative descriptions of negative events included exams or tests, which were most common in our study as well as in the literature, depression, anxiety, and feeling sick. Positive events were represented by descriptors such as a lab going well, being treated to lunch by a friend, or receiving a birthday gift. So, what did we find? We found that 1 in 5 students had had a positive experience, 2 in 5 had had a negative experience, and 2 in 5 had had no event that was affecting their mood. It's interesting that fully 40% of students who attended AAA had had a negative event. We found that before the AAA event, the well-being, stress, and happiness of students reflected the types of prior events they reported. That is, students with positive events reported the highest happiness and well-being and the lowest stress. The students with negative events reported the lowest happiness and well-being and the highest stress. And those with no previous events or neutral events affecting their moods fell in the middle of these. The reported well-being, stress, and happiness of those students with negative prior events was significantly different than those of students in the other 2 groups. Well, what about after the event? After the entire event, including phase 1 and phase 2 of our study, we measured again, and we found similar trends to at the beginning. The negative event group was still feeling significantly less happy, lower well-being, and higher stress than the other groups. And this might lead us to conclude that AAA does not significantly affect students who are having negative experiences, but that would be incorrect. The findings and the table here reveal that all 3 groups decreased stress and increased well-being and happiness. And when we looked at the magnitude of change in the 3 dependent variables, the t-test showed that the students with negative events made significantly greater progress towards mental health than did the students in the other 2 groups. In fact, the scores of the negative group after the AAA event were more positive than the positive event group before the event, suggesting that the AAA event served a compensatory function similar to a positive event that was experienced by other students.
Earlier, Brianne hinted at the importance of touch, and we found that duration of touch is also an important variable to consider. This observation is important when we are considering many people concurrently trying to pet the animals, and supports a recommendation for multiple animals when groups of students are dropping in for AAA visits. We found that 87% of the participants spent 20 minutes or less time touching the dogs, and 68% spent 12 minutes or less time touching the dogs. But even short contact, even 2 or 3 minutes like this, resulted in positive effects. All students benefited from touching the animals. The students who liked dogs the most beforehand had the greatest benefits. This suggests that affiliation for the animals at the AAA is also an important consideration. So we need to pay attention to 3 aspects. The first is opportunities to touch the animals. The second is adequate duration of touch. And the third is prior affiliation to the animals at the AAA event. And all research has limitations, and ours is no exception. We would like to highlight 4 of our limitations of our research. The first is that our findings are based on self-report data. So there are other studies that are beginning to measure physiological effects, such as cortisol levels, to supplement self-report data, and are promising, but ours just focused on self-reporting. The second is that we only investigated the effects of dogs and not other animals. We're curious about whether the fur plays a factor here, and if animals without fur would still have great effects. One student commented that cats are more relaxing when we took their survey. The third limitation is that we did not screen for psychological disabilities, although some students mentioned on their surveys that they experience anxiety or depression, which suggests that AAs can be a universal supplement, but not necessarily a replacement for other student services. And the fourth limitation is that the conditions of the study included trained pet handlers and pets who were trained to observe animal stress and curtail visits when signs of stress were observed. But we have no evidence that institutional ownership of service animals would hold the same animal protections, so therefore we would not recommend them. If there's one thing that we really want you to take away from our presentation, it is the importance of touch, as well as the low cost, universal, and low stigma effects of AAAs on students in different situations. Again, earlier I mentioned how there's a lot of barriers to students accessing other mental health services, and this is a great universal alternative. While many post-secondary schools are closed right now due to COVID-19, students with pets can be encouraged to spend time petting them to reap these benefits. When schools reopen, it is likely that the mental health needs of students will be even higher than they were before. And after getting approval from health agencies, AAs could be a great open to address these needs. You can see here that we've included some pictures of ourselves and our own pets, so you can see why this research has been so important to us. Thank you.